Hi, and welcome to the Mental Minute with Michigan Medicine. I'm your host, Will Heininger, and we are joined today by a special guest, Abigail Eiler. Abigail is the Assistant Director of Athletic Counseling for the University of Michigan Athletic Department and Assistant Clinical Professor of Social Work at the University of Michigan School of Social Work. Abigail, how are you today?
I'm well. How are you?
Oh, I'm doing pretty well, thanks. I'm glad to have you on. As both a former student athlete and an alumni of the Athlete Factory on the other side of Stadium in Maine, Pioneer High School. Glad to have a fellow alumnus on. So, want to get into some of your current work in a little bit, but just talking about your career track and progression to this point. You were a student athlete, you graduated from the School of Social Work, you've done work as a professor, obviously, as a clinician. So can you talk a little bit about your journey, what led you to social work, what led you to mental health work, and where you are now?
Sure. So I come from a really long line of what my family would refer to as healing helpers. Um, my mother was a social worker. My grandfather did a lot of work in the community. My father and my sister are both public servants and have been for many, many moons. So I think it was just inherent that I would go into a helping profession. And when I went through Michigan undergrad, I was looking at all the different disciplines and trying to find what I resonated most with. And I feel that that's true for a lot of student athletes. Where are my interests? Where do I feel fulfilled? And where can I contribute moving forward in society? And so after I graduated from undergrad, I went immediately into working in juvenile justice. And I saw this revolving door effect going on. The same kids were coming in the system, leaving the system, and coming right back in. And I was speaking to the director at the time, Denise Dalrymple, and I said, we're missing something here. And I wanted to understand more. And she said, my recommendation is that you look at an MSW program, look at a master's in social work program, because the questions that you're asking, you can explore through this profession. And so sure enough, I applied to Michigan, went back and got my MSW, ventured into a career in child welfare to start out with. Really looking at those that experienced complex trauma, single trauma incidents, doing forensic interviewing with Dr. Kathleen Colborn-Fowler at the Family Assessment Clinic, and then eventually, thought about getting my PhD. And her recommendation to me was, you've got to figure out what population you want to work with. And being someone who's Native American, decided that I wanted to move out to the Southwest, started working with tribal communities out there, doing family preservation and reunification work, and really diving into the world of community mental health. I feel like it prepared me in so many ways for the position that I'm in right now. I was doing a lot of in-home services. I got to know people at their core, see what it was like being in their environment, exposed to their day-to-day strengths and challenges, and eventually decided get married, got pregnant with my first child, and moved back to Michigan to be near family. Came back to the Family Assessment Clinic. And my relationship with U of M has, just been a journey since then. I've worked in family medicine that I have loved at Livonia Health Center, and made my way back to athletics. It's kind of like coming back full circle and giving back to the population that gave so much to you.
Wow, that's a fantastic answer, and thank you for taking us through all of that. Can clearly see how your experience and especially your time going out west can inform your current work. So you mentioned some of your past experience in working out on the native reservations and doing in-home care, doing care with the people there. I'm curious how that may have informed or prepared you to be a clinician for student athletes. I know in my time as a student athlete, I felt that my therapist had a really good understanding of my life. She knew the people that I worked with, obviously the trainers, the doctors, the coaches, And before I knew what the term integrated care was, I was receiving integrated care. And so when I learned what it was in my 20s in my studies, I was like, oh, no wonder, it worked so well and helped me recover from major depression. So I'm curious about that level of integration into your clients' lives and how it can help you, be the clinician that you are for student athletes.
I think my experiences working out on reservations and being so embedded into the lives and more so the community of the people that I was serving was essential for their recovery. And it was critical for me to truly understand what people were experiencing. So when I look at my experiences there, one thing that I notice most often, and I see the parallels, is the drive and the commitment and the motivation to succeed, right?
Mhm.
Something that we see so much in communities where there is the pressure to be resilient, to continue to recover and move through life challenges, is also very true in athletics, right? So
Absolutely.
yeah, so the community-based care that I was engaged in is so similar to what exists for athletics. The community-based care of being able to show up when needed, to know what's going on sometimes before it even happens, has allowed us to be more preventative than having to be reactionary. Um, there's the balance, right, where you have to find the boundaries, and you look to the student athlete, to the patient, for directive on that, because some will need more, some will want more, some are much more, I've got this, I just need a little bit of help and support along the way. So it varies, and it teaches us the importance of needing to be responsive to what's going on with the person individually in the context of their environment.
Absolutely. That makes all the sense in the world. And I want to get to one of your other many areas of expertise that is related, obviously, both to your past work and current work, and no wonder it's an area of your expertise. But culturally responsive care. Can you talk a little bit about culturally responsive care, maybe what it is to somebody who has no idea, and how it comes into play in your mental health work?
Sure. So culture responsive care, through my lens, whether it be through research and literature or through practice-based evidence, is really embracing that each community has its own nuances, right? Has its own themes and trends that we as providers need to become aware of. We have to look to our communities for that information beyond what the research shows us. It's actually sitting down and saying, like, tell me about yourself, tell me about your needs, and then creating treatment plans and modalities that really complement their cultural needs and request. I always kind of look at it through the lens of cultural humility. Each client is an expert on their own life. And so we need to be responsive to that, allowing our clients to inform us of what they need in order to continue to move forward. I think one of the things that I have really leaned on as it relates to culturally responsive care is the work of Dr. Dolores Sabina Bigfoot out of University of Oklahoma. She has done a lot of work on practice-based evidence and adapting current evidence-based treatment practices for the Native population. We're seeing this across the country, that evidence-based practices are being adapted. But when we really think about it at its core, the reason that we see fidelity in some of these EBPs, right, these evidence-based practices, it stemmed from practice-based evidence, right? The repetition of noticing that something was effective, and then the implementation of the research and, okay, now here we go. Here is this modality that can be utilized where you can get federal funding and beyond. And so I really look to those that came before me to inform how I engage in culturally responsive work as well.
It's so interesting you say that because, when I was struggling and I was the patient and I was so skeptical of anything, right? My thoughts were so distorted that I genuinely believed I would never get better, to working with Barb, and going through intensive therapy and treatment, and obviously getting on the right education, or sorry, right medication. But what happened was, slowly but surely, the evidence, I couldn't deny it, was this is working. Like, I'm feeling bit by bit by bit better. And then once you have that, it sort of felt like I'm learning a cheat code to this whole thing. And so it was amazing on the back end afterwards, and talking with Barb a little bit, ask about, did you use this modality? I didn't know what CBT was, or acceptance commitment therapy was. And she was smart enough not to tell me, the names of the therapies, because I would have questioned them, but just using little bits of things that worked for me, because she understood me and what might work. And I guess I'm reflecting on it, and I'm grateful that there are clinicians like you guys, and experts that came before you to help you gain the expertise you have now. One conversation, Abigail, that we were having a couple weeks ago was the disparities in the populations receiving treatment, whether we're talking about student athlete or the general population. So the disparities in culturally and ethnic groups seeking treatment, or getting treatment, out of the entire group getting treatment, and then the corresponding percentage of cultural and ethnic populations within the student athlete or general population. Could you speak a little bit to those disparities?
Sure. I mean, I think we as a country know that ethnic and racial minorities often bear disproportionately a higher burden of stress, right? Of different things that cause a variety of health disparities, right? We can refer back to the ACEs study that was done several years ago and continues to be relevant today. We can look to present day research about, how, while rates of depression for Blacks and Hispanics and Latinos and those that identify as people of color are lower, we also know that those that identify as people of color also are more likely to have more persistent depressive symptoms.
And
When you're, go
I
ahead.
was going to ask about, what about likelihood of seeking treatment?
Yeah, and I think one of the things is, and one of the key parts of Athletes Connected, right, is the whole aim to decrease the stigma related to mental health. And the stigma is so deeply ingrained into the history of people of color, and kind of the push against help-seeking behaviors has been a constant struggle for us, for many, many reasons, right? It's always, like, pick yourself up and keep going. And that weighs heavy on the hearts of, ethnic and racial minorities. And when we can look at, like, the different percentages of those that are reaching out and getting help, we see that it is disproportionately lower than those that identify as white and Caucasian, significantly. We're starting to see a slight shift in that. We're starting to see more normalization that reaching out and asking for help is okay, but we still have a long way to go.
Absolutely a long way to go. And you speak to understanding the whys that there may have been, over time, for the resistance to treatment, and the multiple reasons that culturally get passed down, and potentially even a distrust of being vulnerable and opening up. However, as you mentioned, one of the strengths of Athletes Connected is decreasing stigma, or I should say, are decreasing stigma and raising awareness and promoting help seeking. I'll never forget, after we presented to, I think it was basketball, hockey, and wrestling. So it was all male, and I thought the dialogue was really good at the end. And then even afterwards, I guess the captain of the basketball team felt compelled to come up individually and he said to me, hey, it may not have seemed like it, but I promise you everybody in here heard that. And that meant something to me, because I knew exactly what he meant, was that we don't talk about this stuff, But we get what you said, and we understand how, of course, like if your mind isn't working the way that it's supposed to, just like your calf or your bicep or your abdominal muscles, like if a part of your body isn't functioning in the way that it's intended, it's going to impact not just your performance, but then your overall quality of life and your mood. And so trying to help athletes understand those connections so they can, as you and G. Harden say, become experts on their own lives, I think is something that, we strive to do at Athletes Connected. So I'm glad that you brought that up. I don't want to take too much more of your time, although we could do multiple episodes with you. You're a fascinating individual, but one of the things I think is most important about you and about your impact on the communities you're in is that you are a woman, you're a woman in leadership, and you're a woman of color in leadership. And can you speak to really whatever you want on that platform, because there are not enough of you, and the changes and the insights that you have based on your experiences and the intersectional components of your identity really bring a lot to all of the worlds that you touch. So as a woman in leadership and a woman of color in leadership, can you speak to how important that is?
So I think one of the things that I always revert back to when I think about being in a leadership role as a woman of color is really kind of the core of what Gandhi said so many years ago, right? Like, be the change that you want to see in the world.
Mm-hmm.
And so every single day when I wake up and I plant my feet on the ground, I think about that. And I say, today I want to live my life in a way that makes my ancestors proud. And I know that, this whole concept, so we have this belief in the Native community, and I identify as a multi-ethnic person. So I am Black, I am a proud Native person, and I am German. And when I think about those things and how that shapes my worldview, I also have to think about how does that shape those that are coming after me. So our whole construct is this belief of the 7 generations. So I am who I am today because of the 7 generations that came before me. How I act and live in this world today will have an impact on the 7 generations after me. And so I have to be cognizant of that and really take the conscious effort and intentional steps with how I exist in the world. And as a woman of color, that's not always easy. Right? There's judgment and critique in many different forums. And it's one that I grapple with, and it's one that I'm also happy to kind of take charge in. And so when I kind of look at my role and I look at those that are coming after me, if I can continue to demonstrate the changes that I would like to see in the world, that I believe will be effective, in getting us to where we're supposed to be, then I know I've done my part.
Well, I think you're incredibly effective at the leadership roles that you have, and very grateful. And I know, speaking for the communities that you touch and that you reach, very grateful that you both are in the positions that you're in and also see it the way that you do, because it's the why that you just shared with us that clearly, provides motivation and drives you to do some of the amazing work that you do. Now, speaking of leadership, one final question. You, maybe an open secret, maybe we are announcing this to the world, but you will be in charge of some of the Athletes Connected research going forward. Are there any particular areas you would like to research further, particular aspects or disparities? Where do you see Athletes Connected research going, or where might you like to look into?
I think the one thing that I'd like to start with is what are the needs of the communities in that we're serving, right? So I'm currently working with the Big Ten Conference Office. Commissioner Kevin Warren has really taken, a firm stance in pushing forward a mental health and wellness initiative. And so I'm really happy to be part of that. And we've started collecting some information about providers and strengths and challenges regarding models that exist at different universities. But what I'd like to see through Athletes Connected is really sitting down with our student athletes, figuring out what their needs are, and then creating research based off of the needs of the community. So I don't know where that will go at this time, but I'm excited about the opportunities that we have for the future. And I know that our student athletes are invested in that as well. So I think the sky's the limit.
Well, we're excited to have you in charge, and that is the exact formula that we used, I guess now 6 years ago, when we started, was what are the needs of the population? And that was before we had a name, Athletes Connected. We were just a grant tasked with improving student athlete mental health. So I'm so glad that that is the formula and the directive that you're going to be giving and using. Abigail, thank you so much for sharing your wisdom and your time and your experiences today. I know I've learned a lot, and I imagine the audience has as well. We're going to have you back for another episode because there's a lot more to get into. But thank you so much for joining us. And if you see Abigail's smiling face around campus, whether it's in athletics or up on the hill or anywhere else in Ann Arbor, because she's in a lot of places, be sure to say hi.
Thank you for having me. I appreciated our time together.
Likewise. And this has been the Mental Minute with Michigan Medicine.